all is good. I'm going back now. And a new shoe.
She has a new shoe.
The study revealed some pretty extensive nerve damage.
Yeah, freezing cold here.
Good Wednesday morning, everyone. I am sick. Not a huge deal. Not fun, but I was coughing here and there yesterday. And then throughout the night I got a pretty sore throat. The cough got worse, and being nauseous and having a sore throat is not a good combo. Because the puking makes the throat hurt worse. And then coughing and being nauseous is not a good combo because, you know, coughing, that triggers my nausea and my gagging. So I'm hanging in there. I thought I was more nauseous lately because of the IV antibiotics, but maybe I was just getting sick. However, the increased nausea started right with the IV antibiotics, so I don't really know. I am not hooked up to my nutrition because later today I have my surgery, my outpatient surgery for MRSA in the toe, and then before that I have a doctor appointment with my rheumatologist to go over the nerve conduction study results. My mom is taking me to this today. So I just gotta make it through those two things. Also, I'm glad I'm seeing my rheumatologist because my hip subluxed last night. So it's better than it was last night a little bit, but it's still hurting, so just gotta get these things done. Harlow is not coming today because we probably have to go straight from my rheumatologist to the outpatient surgery center. And my mom prefers not to have Harlow with us for outpatient procedures, so, you know, she doesn't have to think of Harlow and me. She can just focus on me, and I can understand that. So, Harlow, you're gonna get the day off. Just waiting for the doctor to get in. My mom has tissues because she's sick too. And I'm trying a new mask. My Vog mask needs to be replaced soon, and I was looking for a less expensive alternative. And so far, I like this one. Literally everyone in the waiting room was sick too. There's something's gone around. I'll put a link to the shop in the description. In case you didn't hear me. Well, that was a very informative appointment. What do you think, Mom?
I really like him, and he knows what he's talking about.
He does. So we learned a lot. We're coughing in unison now. We learned a lot from the nerve conduction studies. There's a few more things we have to do. I need to read over the reports again and really make sure I understand everything. And the doctor was thorough. I just like to process stuff a bit first. Also, not feeling well in the car is not really when I want to give y'all all the details from this appointment, so I will update y'all a bit later. Right now we're on the way to my toe surgery. We made it! I am getting fluids. I love my nurse. I gotta see the doctor and the anesthesiologist, and I might be getting IV antibiotics because of my MRSA while I'm here. I'll find out. Yep, I am getting IV antibiotics. It's protocol here, and it's called Ancef. So it's not vancomycin, the one that gave me Red Man syndrome, but it's another one that my culture showed I guess I'll respond to it well. This mask doesn't really stay where I need it to, I'm realizing, but it is comfortable. Anyways, pre-dosing with IV Benadryl, pushing the Ancef, the IV antibiotic, and just going from there. I took out my contacts, put them in a little container they had, got the IV Benadryl. The antibiotic is going very slow. Talked to anesthesia. They're going to use ketamine and Versed, which is a very safe and effective combo for me, anesthesia-wise. And I talked to my doctor, so all is good. I'm going back now.
Hi, baby.
Hi.
So, how do you feel?
I have this cracker, and it's good.
Jaquie likes the crackers. She just got out of anesthesia, so she's...
slept long, really long, and came out nice, with less pain, and a new shoe.
She has a new shoe.
It was good. Look at this cracker.
She likes the cracker. And the new shoe.
So, the last thing I remember is getting onto the table, and then they said you're gonna feel the ketamine and Versed, and then I remember I had to run to get to a bed that was like, I needed to run to it. I guess that was my dream this time. I always have a weird dream. And then I woke up over there, and they said that I could go back to sleep, and I slept a long time. Where's my cracker?
You ate it. No, you ate it. No, you ate it, Jacqueline.
That was a good cracker.
Okay. Let's say goodbye.
This is apple juice.
That is gone too.
And I ran, so I exercised when I was going to get to the bed. And now I have a new shoe, but they didn't give me the other one.
You're so funny.
And they said when I'm better, we can leave. So I want to leave.
We're gonna go. I'll say goodbye. Love you.
I love you.
Bye.
Well, I am feeling more like myself, and we're heading out of here. And oh, I'm gonna hook back up to my feeds right when we get into the car. You're gonna go get the car?
Yes.
Thank you, Mom. I love you.
Love you too. So I'll wait for you outside, okay?
Yep, I'll see you in a minute. Well, not that any surgery or procedure is a good thing, but that went really well, right, Mom?
Yeah.
That was nice.
Yeah, and they were so good. Good personnel, very good side bed manners.
Bedside manners.
Bedside manners.
Yeah, and everyone was very, very thorough to make sure that I didn't have any reactions or lessen it as much as possible. And tomorrow I can take the bandaging off. I have to soak my foot in Epsom salts like I've been doing twice a day, and keep the boot on and keep it bandaged up until I see my doctor on Tuesday. And just because of the way the infection looked, he actually did prescribe another medication for MRSA, but since he got most of it out with this surgery, it's an oral, not IV, that I can crush and put through my feeding tube. I see you peeking. Hi, Harlow. You want to snuggle? Did you miss me? Harlow, hup, hup. Come on, hup. Harlow, hup. Oh, dear she is. Well, I am home and settled into bed. I'm so happy I had my mom with me today, and I had a good procedure, although I'm a little hazy from the ketamine still, but that's totally normal. And yeah, it does hurt, but I can deal with it. I didn't even need prescription painkillers for this, so it's not a big deal. And now I just have to keep it clean and wrapped up and follow all of my instructions until I see my doctor on Tuesday. I am really surprised that I have a shoe boot thing. I don't personally see how that's gonna help me, but the doctor said to use it, so I'll use it. Oh my gosh, I do want to say that I am getting pain relief from the ketamine, and as y'all know, we use ketamine to help treat my chronic pain. It kind of like resets the central nervous system and how it responds to pain. You can learn more about it in my pain management playlist, but when I woke up and came to, one of the first things I noticed was my hip was not hurting me as much anymore. I don't get as much relief as when I do it with my pain management doctor and his team, because they really try to maximize on the pain relief benefits. This time they just used it to sedate me, but I'm grateful for any relief, and it's just such a nice added bonus of the ketamine. It's a safe anesthetic for me, and it helps with my pain. Now the results of the nerve conduction study. So, the study revealed some pretty extensive nerve damage. Now, we knew I had nerve damage because of my symptoms of numbness and tingling, nerve pain, weakness, but we didn't know to what extent until now that we can see it on paper, concrete, from this test. And I've had nerve studies done before, but it's been years and years and years since I've had one, so it's obviously gotten worse. What happens is that my hypermobile joints from my Ehlers-Danlos syndrome move too much and pinch down on the nerves, causing issues. My biggest problem area is my neck, affecting my upper limbs, and I do have some issues in my back affecting my lower limbs. This test didn't just reveal the extent of the nerve damage, but also just how problematic my neck is from my EDS, and we've known that it's been a problem area. So my doctor wants me to get more imaging, an MRI with and without contrast of my neck, some x-rays, and he also suggested getting a neck brace to use, not all the time, because honestly I don't want to use a neck brace all the time, but he said when my nerve issues are flaring a bit, when my neck pain is flaring a bit, I can use it around the house. And he's not the only doctor who suggested a form of bracing for my joint issues, and so what I've done is I've actually made an appointment with a hanger clinic, and they're all over the United States. The one in our area is supposedly really good, and what they do is they evaluate you for what braces would work best for you. So I've taken all the scripts I have, like a script for a neck brace, knee brace, hip brace, whatever, and then they'll evaluate me and help me choose the best one, and that's happening at the end of December, because if I need to do this, I want to do it right and make sure I get the braces that are going to help me rather than harm me. After I get the imaging done, then I'll see my rheumatologist again and we'll go from there in ways of a treatment plan or whatnot. He's also encouraging me to stick with my physical therapy, which of course I am doing, to strengthen the muscles around my joints. And I'm just going to keep doing the best I can do. I'm very happy to report that my nausea seems to finally be under control after the past few days. I really think it's the IV antibiotic causing the issues, which I do have to stay on IV Rocephin until at least Tuesday when I see my doctor again for the MRSA surgery thing. But I feel like we're making progress in the right direction. And I'm gonna rest a little bit more and then try and eat some soup my mom got me for dinner. Well, I rested some more, and I gotta say I'm feeling much better than I was feeling this morning. This morning I felt really not well, so don't know why, but I'm feeling some relief and I'm thankful for it. Oh, you want to come on the bed again? Come on, Harlow. Harlow, hop. Hop. Snuggles. Hi. Boop. I love you too. So I was able to eat a little bit of the soup my mom got me. She got me some soup from Panera, which was nice. I'm enjoying time with Harlow, and I realized that this video will be uploaded. Oh my gosh, you just stepped on the remote and moved the bed. Where is it? She's moving the bed. You're laying on it. Okay, I found the remote. That was under your bum. Silly dog. So, as I was saying, tomorrow is Thanksgiving when this video will be uploaded, and I know that holidays can be difficult or different depending on your circumstances, so just know that if today is a happy day or a hard day, my thoughts are with you. What we're doing for Thanksgiving is my dad and my aunt will be here tomorrow on Thursday, and I'm gonna spend the day with them and my mom. My parents are divorced, but they get along. Judd's working on Thanksgiving, but on Friday he's off and we're going to Orlando to have a Thanksgiving meal with his mom. We had like a Fakesgiving, an early Thanksgiving with his mom and his sister, but we're going back to be with his mom for like actual Thanksgiving. I don't know. With Judd's schedule and stuff going on in our life, we got to be flexible about when we do things, so we're having Thanksgiving on Friday, I guess. And Harlow, you're just gonna come along for the ride. So easygoing and lovely. I love you. I hope you enjoyed your day off. Well, anyways, that is it for my day. I am ready to go to sleep, even though I slept so much with the anesthesia. It's just a normal side effect to be drowsy. So with that, I will say goodnight, and thanks for joining us on our adventure.